And lo and behold, some arms of the study actually showed that the women on hormones had a lower risk of breast cancer.
I know from my own experience when I started having a lot of symptoms of menopause or perimenopause or whatever, it was just a full on, it felt like an assault because I couldn't sleep. I was anxious. I was losing my hair. Like
Mhm.
down the checklist. And when we had talked and you suggested doing some hormone replacement therapy, for me, it was like a no brainer. I was like, I'm going to do anything to live
Mhm.
better because it was just such a terrible quality of life. In talking with other women, I think particularly maybe women that are a little bit older than me, I still hear a lot of resistance to the hormone replacement therapy.
Yeah.
Oh, estrogen causes cancer, or that kind of thing. What do you say to women that maybe still have those notions?
When you and I first met, there actually the data that's available now what did not exist. There has been some new research. And even with the new research, the original research that was done back in the 90s was done on the wrong set of women at the wrong dose of estrogen. And so therefore the conclusions were really not even applicable to women in their 40s, 50s going through perimenopause and menopause. And so, luckily, the research was redone on the proper population with the proper dosing of estrogen. And lo and behold, some arms of the study actually showed that the women on hormones had a lower risk of breast cancer.
Mm.
So a lot of women don't realize that if we get stuck in the old information and just this mindset that was driven into us in our 90s, and even the newest information which was released during the menopause society meeting just a week or two ago, is now they're actually thinking that women who are started on hormone replacement within 10 years of going through menopause have a 60% lower risk of getting breast cancer. And that
Wow,
is like huge. Now it
definitely.
doesn't that doesn't just release everybody a blanket, all women get hormones. You still need to process that information, do risk assessments, which I do on every single one of my patients, and make sure that you are a good candidate for it, family history comes into play, etc.